Good afternoon, everyone. Rob here again from Nutridyne Europe, and I'm back with Dr. Robert Silverman for lesson 3, which is sleep matters, the missing link in functional medicine. Same as before, if anyone has any questions throughout the webinar, feel free to ask in the questions box, and I'll pop back at the end and put your questions to Dr. Rob. So let's get started. I'm going to pass it straight over to Dr. Rob, and I'll see you all at the end. Thank you.
Hey, Rob, thanks so much. It's my pleasure. We're here at lesson number 3. I'm truly excited about the opportunity to talk about sleep. I do believe it's the missing link in functional medicine, and I think it's something that a lot of us as practitioners don't talk enough about. And I've surveyed some of the doctors, and they've said they didn't want to talk about it. They didn't think it was in our scope, if you will, or our armamentarium. And I think it is. And I think there's a lot of good that can come from this. So let's start off by just really saying that sleep is the missing link in the functional medicine equation. So when we talk about sleep, we often focus on the quantity as it relates to the body's ability to recover from specific injuries or performance levels or chronic conditions. We often neglect the quality of sleep, that especially sleep plays that role in brain health, specifically linking to poor memory, trouble concentrating, maybe age-related dementia, and of course the big cat, if in the room, Alzheimer's disease. Poor sleep also, as you will see, leads to harmful eating habits and increase in the risk of obesity and diabetes, and a higher risk even of some cancers, and without question, poor gut health. So by the end of this 60 minutes or so, I'm going to share some leading edge protocols and actionable steps to help you take your practice to the next level and incorporate sleep as a discussion point. Sleep is vital, often neglected component of every person's overall health and well-being. Sleep is important because it enables the body to repair and be fit and ready for another day. Getting adequate rest may also help prevent, as I said earlier, excessive weight gain, heart disease, and increased illness duration. Sleep helps your brain work properly. While you're sleeping, your brain is preparing for the next day. It's forming new pathways to help you learn and remember information. Studies show that a good night's sleep even improves learning. I always like to start with a quote. Sleep is that golden chain that lies and ties health in our bodies together. So the importance of sleep, kind of rolled over it. Let me give you 10 reasons why sleep is truly important. And if anybody's interested, I do have some articles coming out on sleep, and I'd be very happy to share them with you on the importance of sleep. So number 1 is poor sleep is linked to higher body weight gain. Interesting in that short sleep duration is associated with an increased risk of weight gain and obesity in studies in both children and adults. Good sleepers tend to eat fewer calories. Obviously, they're eating fewer calories because poor sleep affects hormones that regulate appetite. Those who get adequate sleep tend to eat fewer calories than those who don't. Good sleep can help improve concentration and productivity. So it does so by maximizing problem-solving skills and enhancing memory. Poor sleep actually has been shown to impair function. Good sleep actually helps improve athletic performance. The longer sleep has shown in literature to improve many aspects of the athletic and physical performance and even your activities of daily living. Unfortunately, poor sleep or poor sleepers have a greater risk of heart disease and stroke. So really sleeping less than 7 to 8 hours per night is linked to that increase of those issues, those cardiovascular issues. Sleep affects glucose metabolism and increases the incidence of type 2 diabetes. Poor sleep is also linked to depression, especially with those who have sleeping disorders. Sleep helps improve your immune function. Getting at least 7 to 8 good quality hours of sleep can help improve your immune function and help you even fight the common cold. And we all know with what we're all going through worldwide now with immune function, this is one untapped area that many practitioners are not discussing. Poor sleep is linked to increased inflammation. And in that increased inflammation, I'm a big proponent of always managing, modulating inflammation. That inflammation really goes to the idea of gut health, inflammatory bowel, etc. And last but not least, sleep affects emotions and social interactions. So, you're a little more crabby, for lack of a better term, when you don't get a good night's sleep. And that really bodes to the bad social interaction. So why do we sleep? Well, restoration, a consolidation of memories and resetting synaptic strength. You also want to detox, flush toxins from the body that build up during the waking hours. So during sleep, glycemic pathways, known as your brain lymphatic system, are 10 times more active at sleep, ridding the body of toxins such as amyloid, tau, and other molecules. Believe it or not, metabolic waste was cleared most efficiently when people slept on their left side. So sleep disorder impacts heart disease, diabetes, mood disorders, autoimmunity, obesity, memory issues, immune dysfunctions, and micronutrient deficiencies. If we were to talk about COVID-19 and the comorbidities, essentially you would be looking at the same chart as a sleep disorder impacting. Sleep is truly the backbone and is without question the missing link in functional medicine. Those sleep disorder impacts. People who have these disturbances have a higher addictive rate of consuming alcohol, marijuana, and some sort of drug use. Also, interesting, if you get a good night's sleep, you may delay the onset of that addictive personality disorders. And last, higher rates of disorders really go to those mood disorders and really lead to the idea of anxiety. So if we're talking about anxiety and trying to have anxiolytic type of outcomes, I'm a big proponent in fixing people's guts and getting a better night's sleep. Alcohol dependency and sleep. Those with insomnia, 55% were more likely to use alcohol. As many of my patients say, I happen not to drink. They find the alcohol enables them to have a sedative effect and get to sleep. So a higher alcoholism relapse rate is present for those who suffer in insomnia. And the alcohol may also lead to sleep disorders with either causing issues falling asleep or disturbed second half of their sleep. Sleep deprivation, not getting good 7 to 8 quality hours of sleep. These patients experience lower pain threshold, or if you will, more pain, learning disorders, appetite suppression, seizures and epilepsy, and an increased incidence and progression of cancer. Poor and no sleep. Study shows poor sleep quality and duration is linked to chronic health conditions. Another study, and something really to take a look at, is the circadian-based therapy helps sleep duration for night shift workers. They call the night shift workers. I have a patient who's a nurse, and she works midnight to 8, and I call it the graveyard shift. And she doesn't want to hear that because she understands that that increases your incidence, working through the night, increases your incidence of mortality, increases your incidence of injuries, and understands that it messes with your circadian rhythm. So make note, I'm somebody who does travel a lot. Obviously, that's changed a lot in the last few months, but that circadian rhythm is a critical element. So coming from America in Eastern Standard Time, if I were to go across the pond to England, that's a 5-hour change. And that's a substantial advancement in time. It makes it more difficult for me to stay within my circadian rhythm. So the back and forth for people who have to travel for, vacation or holiday or business can have some damage to their health if they don't take that into account. Sleep. New indications indicate that sleep problems are prevalent both amongst students because students go back and forth. So insomnia was very high for both women and men, but higher for women. Sleep's effects on genes. I hope to have a conversation. I'll speak to Rob about this. If we could add a gene webinar or a gene and an epigenetic webinar. So genes are not your destiny. They load the gun, they don't fire the gun. And epigenetics is what you express in your gene pool from environment. A week of sleep deprivation, like finals time, alters function of 711 genes, leading to stress, inflammation, immunity, and metabolism. The best book I've ever read on sleep is Dr. Matt Walker. Poor sleep hinders weight loss. So there's a link between insufficient or disrupted sleep and weight loss found. Researchers show that overweight people who don't sleep well lost less weight than the peers who had no sleep problems. Another key element, which I alluded to before, sleep variety or variability. Patients lost less weight than those who had regular sleep patterns. The idea of sleep variability is not sleeping the same number of hours per night. And obviously, when you go in time zones, that poses an issue. Insomnia. I had to use American numbers. I didn't have EU numbers or anything like that, but it was in patients over 65 years old, more than 50% had difficulty falling asleep. Insomnia is linked to a lot of deleterious conditions like hypertension, diabetes, heart attack, depression, etc. It is the #1 culprit of stress release of cortisol. So let me give you some numbers. 5 times the risk of hypertension with those who slept less than 5 hours. 3.5 times the risk of that occurring between sleeping between 5 and 6 hours. 1 in 4 Americans, and I did notice this with, again, people from the EU, experience acute insomnia each year. 30 to 35 have brief symptoms of insomnia. 10% of chronic insomnia disorders, which means that it's occurring 3 times a week for at least 3 months. So irregular sleep patterns are linked to metabolic disorders. Not adhering to a regular bedtime and wake-up schedule and getting different amounts of sleep put each person at a higher risk, once again, obesity, high cholesterol, hypertension. An hour change in variability. So if I'm in the Eastern Standard Time and I go to Central, that's the 1 hour change, 27% increased chance of experiencing metabolic abnormality, 1 hour. Inflammatory diet's effect on sleep apnea. It always goes back to what we're eating in our lifestyle. So the dietary inflammatory scores were very efficient at predicting sleep apnea. So patients who had a more inflammatory diet, grain, sugar, gluten, and dairy, obviously led down a path of not being able to recover because of sleep. So many people look at me in such an inquisitive manner, perplexed manner when I say diet is a potentiator for inflammation. Here's a huge takeaway. Diet is a potentiator for inflammation because you don't get a good night's sleep. To piggyback on that, poor sleep leads to harmful eating habits and increasing incidence of obesity and diabetes, or what I like to refer those two together as diabesity. We're getting to the gut. Microbiome's effect on the sleep. The microbiome produces and releases many sleep-influencing neurotransmitters, such as dopamine, serotonin, GABA, and melatonin. These are also produced in the brain. So the microbiota, our environment in our gut, seems to affect on how we sleep. And having said that, sleep and the circadian rhythms inversely affect or conversely affect health and diversity of our gut. And we all know that the diversity of the biodiversity of our gut is a critical element to our overall health. 80% of immune cells are in our gut. The microbiota's effect on sleep. Doesn't take long for poor sleep to affect the gut. Significant decreases in the different types of beneficial bacteria and also decrease in insulin sensitivity if we get better sleep. Unhealthy gut is linked to poor sleep and cognitive decline. Lack of sleep seems to intensify anger, impairs adaptation, and can lead to frustrating circumstances. We've all felt it. I again use that example of finals time. Sleep has a direct correlation with Alzheimer's. The study found that when young and healthy men were deprived of 1 night's good quality sleep, they had a higher level of tau protein in their blood. Tau leading to tau tangles, leading you to Alzheimer's. You'll see one of the last slides will talk about the brain's ability to detox and actually shrink to 40% and squeeze sponge metabolic wastes. Some of these metabolic wastes are these tau tangles. Missed sleep and increased appetite. Sleep loss can make you eat more. Sleep deprivation can trigger a reward system in the brain responding to food stimuli. Small amount of sleep loss, just to reiterate, puts your brain on hyperactivation for specific food triggers. So when I first started in the functional medicine world, as many people do, I started helping people with weight loss. And in weight loss, I sometimes didn't understand why people failed or why people hit a plateau. Sleep was one of the missing links to that. Understanding sleep and sleep's effect on hormones and even gut health really enables me to get better clinical outcomes as before when I didn't consider this valuable item. Sleeping pills. Frequent use is linked to increase in dementia. We should always, when we have a patient, take a look at what drugs they're taking so we can see the side effects and what kind of damages they cause in our patient's body. 40% of people were more likely to develop dementia over a 15-year span for those who took sleeping pills. So this may not be the answer. So taking a look at this interesting slide, when we look at the amygdala, and I'll be honest with you, if you really want some good information on the amygdala, Brainwashed by a colleague, Dr. David Perlmutter and his son, is an excellent read. However, let's take a look at this. Fragmented REM sleep may decrease the amygdala's ability to produce emotional memories overnight, which may lead to more bad emotions and insomnia the next day. This creates a cycle of bad feelings and insomnia. One little caveat, I know that we have a lot of people, we have several people live, I should say, and we have a lot of people in Memorex. Rob is there, so if you have any questions, send them in and we will definitely address them. I'll leave a few minutes at the end so I can answer all the questions. And for those who are listening Memorex, because it is during the day and I understand everybody's back at it, send those questions in. Rob will answer them, or Rob will contact me and I will answer them. We're not just going to leave the webinar there for perpetuity without any conversation. So I just wanted to make a point of that as we're, almost halfway through, if you will. The importance of sleep. Quality sleep is critical to optimum body function. Poor sleep or low sleep or quality sleep is once again linked to low cognitive performance, increased risk of heart disease and diabetes, hormonal imbalance, a poor immune response, once again, obesity, depression, anxiety, and believe it or not, vitamin D deficiency. I always wondered, what blood test can I take to ascertain if someone's having bad sleep? And for right now, there really isn't one. There's a bunch of markers that we'd have to look at. So root causes of sleepiness, because when you deal in a functional medicine genre, you're always looking at root cause. Neurotransmitter imbalances, looking at GABA, serotonin, dopamine. Lack of precursors to make neurotransmitters. Excessive glutamate, and that is one of the reasons why we're going to be recommend taurine, pure taurine, as a great choice. The HPA axis dysregulation. Anxiety and stress. Excess of insufficient cortisol production. Environmental factors. I could do a whole webinar on environmental factors and BPA's effect and things of that nature. And last but not least, put the computer down before you sleep. Put the phone down. Electromagnetic fields. Life is without question rhythmic, cyclical, and dynamic. So without question, you have to stay connected with your natural rhythms and their cycles. These are critical elements to good health. Aligning your daily activities to be in sync with your biological clock or your reset biological clock is a great step to promoting good quality sleep. So sleep is, without question, your circadian rhythm. It's your connection to nature and your natural order. It's very interesting when you look at this. And it would take a lot of time, but take a look at melatonin secretion occurs at 9 o'clock. It stops at 7:30. So you're clearly looking at some form of a time frame where you want to get your 8 hours or your 7 to 8 hours. Take a look at 10:30. Many people don't poop after 10:30 at night, and your deepest sleep is at 2 a.m. So clearly that's a time you want to be asleep. So take a look at this clock. It's very, very interesting. And when you think about when your best time to perform athletic events is truly between 2:30 and 3:30. Lifting weights, 5 p.m. Not in the morning like you think, 5 p.m. Circadian rhythm is our body's own internal clock. It's about a 24-hour clock. Factors that can influence positively and negatively our circadian rhythm are brain hormones, stress, light and dark, and the timing and the size of our meals. Well, again, I got this stat from America. So out of 325 million people, approximately 50 to 70 million people are not sleeping and have chronic sleep and wakeful disorders. That's a substantial percentage. 24-hour sleep, wake cycle, circadian rhythm phases dictate when your body wants to sleep. So you've got a delayed phase, you have a standard phase, and you have an advanced phase. The disparity between when the body wants to sleep and what society expects can actually lead to sleep deprivation. So take a good look of the ebb and flow of melatonin, cortisol tides following the night and the day. Cortisol, to define it, is a stress response hormone. It actually rises during the day, declines at night, and cortisol is actually helpful in certain instances in that it supports awareness and ability to respond to appropriate demands. Melatonin, it's a sleep hormone, rises at night in response to dark, declines with light. Melatonin is a great way to support good quality sleep. While sleeping, our sleep cycle goes through 5 unique different stages. First stage is light sleep. Body movement decreases. There's a release or a need for serotonin. Stage 2, intermediate sleep. Most of your night is spent at this stage. It's very refreshing for the body, and that's when you would want melatonin. Stages 3 and 4 is deep sleep. Kind of hard to wake you up. Do you ever press anybody and they didn't wake up, or the dog's in deep sleep, don't mess with it? It's very restorative sleep. Last 30 to 40 minutes, you need serotonin there. And last, interestingly, is REM, rapid eye movement. That's where dreaming occurs, and you wake up and go, I had a dream, and then you wake up and you realize you're up for the day. Your heart rate increases. It's a short duration of time, and stages of acetylcholine, histamine, and GABA are depressed at that stage. So within the stages, we cycle from less in deep sleep to more time spent in active REM. So as the sleep ends, entering stages 3 and 4, deeper stages of sleep is less until we awake. That sleep-wake disruption cycle results in difficulty in falling asleep, difficulty in maintaining sleep, waking too early, daytime impairment or distress that's associated with impaired sleep. Remember, as I said earlier, 3 times a week or more of sleep issues, you have what they consider insomnia. So let's take a look at some circadian sleep disruptors. So the environment, interestingly enough, what's most interesting is, let's take a look at this. In the Journal of Family Practices 2010, they had a shift work disorder that occurs when individuals are unable to successfully synchronize their internal clocks with a work schedule that required them to stay awake and when dark and sleep when it is light. So they had to assess this SWD, sleep work disorder. They took a thorough sleep history and had the patients maintain a sleep diary. Conditions that commonly occur in conjunction with this illness, including sleep apnea, restless leg syndrome, depression and anxiety disorders, and believe it or not, chronic fatigue. The treatment very simply was they reduced the rate of circadian misalignment by fostering better sleep when it's designed and improve alertness and functioning when appropriate. They used non-pharmacological strategies that were tried and considered before any kind of medication and found to be quite effective. They were new sleep changes, environmental changes, diet changes, and supplemental additions. Age, health status, and social expectations. So you have this deep sleep phase. It's where adolescents and young adults, social expectations, normal total sleep time. DSP, persistent inability over 6 months to fall asleep and awake at socially accepted times. Ability to maintain sleep once sleep is achieved. and you probably have peak alertness. People wake up and say, man, I'm got my vampire hours. I'm nocturnal, 11, 12, 1 o'clock at night. You also have advanced sleep phase, elderly and depressed, usually stable sleep schedule, normal total sleep time, persistent sleep onset between 6 and 9 p.m., early morning wake up, generally 3 to 5. Peak alertness for them is in the early morning hours. Sleep aging and cognitive dysfunction. Diminished REM frequency was associated with aging. REM sleep alterations and dementia may reflect the loss of specific neurons, and reduced dream recall may be a sensitive indicator of that type of neuronal reserve. I'm going to take a few minutes on this, the mediators of inflammation associated with disrupted sleep and chronic illness. So what we're noticing is their inflammation is increased. So when you look at something like an endothelial 1, it's a vasoconstrictor. It's soluble. It actually leads to leukocyte adhesion. So they did a study on it, and the purpose of the study was to examine if the quality of sleep in relatively healthy individuals without a known sleep disorder was associated with inflammation. They assessed circulating levels of interleukin-6, SI-CAM-1 and ET1, and a standard battery of specific sleep indexes in a group of healthy men and women. An inflammatory state is known to exist in sleep disorders because of the elevation of interleukin-6. Now, as we know, interleukin-6 is that inflammatory cytokine that's elevated in sleep apnea and narcolepsy. We also know that interleukin-6 leads us towards the cytokine storm and a cytokine storm syndrome. Interesting. Better sleep is associated with decreased daytime secretion of interleukin-6, whereas disturbed nocturnal sleep is associated with increased daytime levels of interleukin-6. Some of the other markers of inflammation include ET1 and circulating soluble form of ICAM-1 may also be elevated in a setting of sleep disorders. As I said earlier, ET1 is a potent vasoconstrictor and mediator of inflammation elicited from endothelial cells. So essentially, the mediators of inflammation, because of lack of sleep that you're seeing on this slide, lead you down that detrimental path. So sleep-related breathing disorders, some of the common physical findings if you wanted to do a physical exam would be enlarged tongue, overweight or obese, they just can't breathe, larger tonsils, smaller jaw and retruded chin, and nasal polyps. Some of the more common signs and symptoms: snoring, irritability, personality changes, depression, diminished performance, morning headache, high blood pressure, diabetes, stomach acid regurgitation. Caffeine sensitivity. So I just want to make a couple of points before we get into this. It's a stimulant, as well we know. Now, where I'm from, more caffeine comes from coffee. You guys drink more of a tea. Certain teas have more caffeine than coffee. Caffeine and coffee and tea are clearly health. They are an elixir without question. Having said that, caffeine has about an 8-hour half-life. So the buzz really on caffeine is some people have a lot of issues, and some people are fast metabolizers of caffeine, normal, and slow. You'll know you're a fast metabolizer if you drink it and you run to the bathroom. If there's a normal duration of time, you're average. And if you're slow, it just lags and lags, and you can't have it past 2, 4 o'clock in the afternoon. Genetic tests will lead you down a path of determining if you're a fast or slow metabolizer. So let's look at some of the current sleeplessness prescription therapies. So this is for everybody's edification. I don't really want to go through this. These are some of the medications that may affect sleep. So you can take a good look at them. These are some of the more common things given to our patient base. Please make note of a thyroid hormone, cholesterol lowering drugs, and antidepressants. So who would benefit from a natural approach to disrupted sleep? Well, anybody who has difficulty going to sleep, Anybody having difficulty maintaining sleep, somebody who gets up too early, somebody who's chronically tired despite the opportunity for good sleep, sleep and daytime impairments of distress, and once again, the insomnia. In America, $50 billion are spent in America on sleep aids and remedies. So the summary of the sleep-wake cycle biochemical mediators. Once again, this disrupted sleep-wake cycle. Limbic HPA axis hyperarousal, low endogenous amounts of melatonin, neurotransmitter imbalance, and that neuroimmune cytokine imbalance. I know I've said it a few times, and I really want to stack on the idea that cytokines are released from lack of sleep. So prescribing sleep lifestyle changes and sleep supplements are excellent choices to help people with their overall health issues. So we're about halfway through, a little over halfway through. Now I want to get to the key nutrients for sleep. So let's take a look at B6, taurine, 5-HTP, passion flower, lemon balm, hops, and valerian root, L-theanine, calcium and magnesium, and GABA, but unfortunately, I listed GABA. GABA right now is not something that you guys are able to use. We're hopeful that it's going to be able to come through. So here's B6. Cofactor and tryptophan serotonin pathways helps to catalyze 5-HTP to serotonin. How is serotonin produced? Well, let's go through it real quick. Tryptophan, you've got 5-HTP, which enables you to make serotonin. You need some cofactors, and ultimately you're able to make melatonin. So B6 or P5P is essential for over 140 enzymatic reactions. As you saw before, it's a necessary cofactor in the folate cycle. B6 is a rate-limiting cofactor in neurotransmitter synthesis. I think you guys are going to like this, the glutamate and neuroexcitation. So glutamate, when released, will stimulate the NMDAR receptor site. That opens the idea, and the PowerPoint will show this, the release to calcium. Calcium coming from extracellular space into intracellular space leads you down a path of plaquing inside the brain. In addition to that, potassium goes from the intracellular to extracellular and damages axons. You want to blunt this. You want to block this. Now, understand that many of us use glutamine in many of our gut protocols, and I strongly recommend that you continue to do so. But excessive amounts of glutamine leads to glutamate. So having covered all that, what is my suggestion to blunt the excess amount of glutamate from glutamine and glutamate's problem or ability to open up the synaptic cleft? The advent and addition of taurine. Taurine decreases excitotoxicity. Taurine is something that you should keep in all your protocol lists for gut health and brain health. To me, taurine may be one of the biggest missing supplements that we don't recommend enough of in our office. And the name of the product, quite frankly, because you're going to ask, is pure taurine. So 5-HTP, there's tryptophan. 5-HTP stops hunger. Serotonin alleviates depression, migraines, and fibromyalgia, ultimately leading to melatonin, which promotes sleep. So 5-HTP, which is going to be in the protocol, is an intermediate metabolite in the synthesis of serotonin. It ultimately helps produce melatonin, aids in sleep. This slide really goes through how 5-HTP and passion flower are very synergistic for positive tryptophan outcomes. There's your 5-HTP. There's your passion flower. Passion flower, again, synergistically attaching with 5-HTP to ultimately produce melatonin. Passion flower, blue crown passion flower, contains flavonoids, strong anxiolytic benefits, high antioxidant, anti-inflammatory, and anti-convulsive herb. Overcalming effect and anti-anxiety of passion flower, MAO inhibitor, thus improving depression, stress, anxiety, sleep disorders, and restlessness. It even stimulates GABA production and may be used for muscle spasms and pain. It's a great study done on passion flower. I always like to add a few studies into every nutrient that we use. So here there were 36 outpatients that were diagnosed with GAD. Patients were allocated in random fashion. 18 went to the passion flower and 18 to a drug. The bottom line, the result was passion flower and the drug were both effective in the treatment of general anxiety disorder. There was no significant difference between the two. The drug was a little quicker. However, within its ability to be quicker because it's more downstream, it was significantly causing more problems relating to impairment of job performance. So when you really look at it, passion flower is a great choice and stood up to the drug option and really didn't give any side effects. Lemon balm, shown to improve sleep quantity and quality. It reduced sleep disruption. It increased calmness during sleep. And the German Commission on Recommendations recommended it for use for sleeplessness associated with anxiety. So here's some of the botanicals used for their mild sedative and anxiolytic properties. Valerian root, lemon balm, passion flower, hops, and Chinese skullcap. Here's another study really looking at different herb extractions, and those herbs were valerian and passion flower and hops versus a drug. What was the findings? The polyherbal extracts were found to be safe and effective in the short-term alternative for insomnia to drugs. Single dose, healthy volunteers, lemon balm, valerian root. The lemon balm and valerian root possessed anxiolytic properties in healthy volunteers on ratings of anxiety. Taking it a step further, the findings showed that healthy adults with sleep disturbances, the valerian root hops combination helped them reach deeper sleep and improve sleep quality compared with placebo. So feel very resolute in the idea that these formulas with these nutrients will help people get good clinical sleep outcomes. Magnesium is an essential element, does so many enzymatic reactions. Again, got some studies and numbers from the US. Sorry about that, have inadequate magnesium intake. Even in the EU, everybody has magnesium intake that's too low, because even if you take the proper amount of magnesium when we drink our coffee or our tea, it strips the body of magnesium. So we have to take a lot of magnesium, and I think magnesium should be called the missing mineral. Magnesium is clearly involved in sleep regulation. Magnesium and sleep quality. Here they did an 8-week randomized control study where they found out that increased sleep time and sleep efficacy, decreased insomnia and severity index, decreased serum cortisol concentration, and of course increased melatonin concentration. 20-day elderly subject, they actually partially reversed some of their sleep issues and modulated their nocturnal hormone secretion. So let's look at healthy sleep hygiene, resetting our biological clocks. Tips for getting a good night's sleep. Interestingly enough, number one, let's maintain a regular sleep schedule. Our sleep-wake cycle is regulated, as we talked about, by our circadian clock, and our brain and our bodies need to balance both sleep and wake time. So a regular waking time in the morning strengthens the circadian function. It can help with sleep onset at night. That's why it's so important to try and keep a regular bedtime and wake time, even on the weekends and even when you travel. Give yourself 15 to 20 minutes to fall asleep. Just don't go in there and say, if I go to sleep at 12, I'm going to get up at 7 and go to sleep at 11:59. That's probably not going to work. You know, lights off. I don't use a sleep mask. Many people do. Reduce the noise. Create a conducive sleep environment. I do want to talk, I've got some slides to talk about sleeping on a comfortable mattress and pillow. Once again, sleep on the side the left side. Sleeping on your left side, just like this is depicted in this picture, enables you to have the best type and best outcome of brain detox. Trying to eat before you go to sleep. We've talked a lot about intermittent fasting and also time restrictive eating. You don't want to sleep before you go to bed. You don't want your body digesting. You don't want a high sugar intake. You're not going to be able to go to sleep. And of course, avoid caffeine, nicotine, any kind of stimulants close to when you're going to sleep. Exercise regularly. It's best to complete your workout a few hours before you go to sleep. You're really sore at 5 o'clock. That may not be the best time for cardio. We usually end our work at 4 or 5 and may not be able to get to the gym, but that's when we're most apt. Have your last meal, finish up, do what you do in the evening, and then start looking for sleep and a good quality night's rest to rejuvenate your cells and put you on a path for health promotion. So once again, just want to reiterate a few more tips for getting a good night's sleep. 1, shut off all electronic devices 2 hours before bed. I know that's tough. Most people don't do it, but if you have them on, lower the brightness. It's the bright light that's getting to you. Maybe stretch before you get to bed. You know, we all stretch when we wake up. We all prepare ourselves for the day. I don't know why we don't prepare ourselves to get rest and recovery. Dosing your sleep aids begin about 1 to 2 hours before going to bed. Don't take those don't take your magnesium and calcium right before you go to sleep. Take it an hour or two so they can get broken down and start to aid you. And for those with anxiety, take smaller doses in the evening and begin to calm. So for those who have trouble with anxiety and getting to sleep, don't take the dose of your supplements all at once. Titrate them up before you go to sleep. So I want to really detail, we have a few excellent sleep formulas. So this is the Nutridyne Sleep Protocol list options. These are things that I use in my office. Muscle Ease Advanced, suggestion is 3 caps before sleep, 1 to 2 hours. Stress Essentials Serenity, 2 caps daily. Stress Essentials Relax, 2 caps daily. 5-HTP, 1 cap 3 times a day. And we talked about it before. Pure Taurine, 2 caps daily. So let's, without question, let's really go over and dig in a little bit into the Muscle Ease Advance. So what's most interesting is Muscle Ease Advanced supplementation contains key herbal abstracts that ease and relax muscle tissue. It also shows that it may also help with not only relaxing muscle tissue, delayed onset muscle soreness, help support healthy magnesium and calcium status, and support calmness. So let's look, muscle, and this is more of a muscle, but magnesium, you want your muscles to relax so you can relax. Magnesium and calcium are, without question, essential minerals that work in conjunction to support bone mineralization, protein building, muscle contraction, nerve impulse transmission, and immunity. Supporting healthy magnesium calcium status, this formula includes highly bioavailable forms of these 2 muscle supporting minerals. More magnesium, more calcium gets absorbed by the body, help promoting muscle function, muscle integrity, better sleep. Some additional ingredients are malic acid. Malic acid is it's a key intermediary in many biochemical processes and also needed or necessary for energy production and muscle tissue. Vast research suggests that malic acid has synergy with magnesium for supporting muscle function. The herbal extracts, which we talked a lot about, are in this formula, are passion flower, hops, valerian roots, and lemon balm. They're all here for critical neurotransmitter support, healthy stress, and muscle function. So here we have research suggesting this proprietary herbal blend in Stress Essential Serenity provides phenolitic compounds and antioxidant properties to support stress reactions and stress response. You know, it's interesting, 40% of adults have been shown to suffer from chronic stress. So over time, if you have chronic stress, and we're in a stressful time right now, this may be a significant negative impact on your nervous, cardiovascular, respiratory, digestive, metabolic, and endocrine systems. So Stress Essentials Serenity carries that herbal blend It's basically used for reducing the effects of the aging process, supporting cardiovascular health, promoting cognitive and performance and brain health, and without question, supporting sleep habits and patterns. So these selected herbs have a high medicinal value in traditional Chinese medicine due to their ability to promote healthy oxidative stress in the body. Antioxidants also play a critical role in reducing free radical change that's at the root of many of these ailments. So if you feel that they're stressed, this is the choice: Stress Essentials Serenity. If you feel they need to chill out and relax, the research suggests that the nutrients in Stress Essentials Relax play pivotal roles in supporting a healthy balance between GABA and glutamate in the body, as well as serotonin and cortisol. Therefore, these nutrients can help promote a better sense of calmness and relaxation. So the innovative formula has key neurological supporting ingredients. I didn't put them up there, including NAC, taurine, EGCG from green tea, magnesium, and vitamin B. Ultimately, the formulation will help healthy GABA glutamate balance, to reiterate, support relaxation and tranquility, support cognitive function and healthy mood. And we all know stress is an essential part. People have been estimated in different populations to have 65% of adults are dealing with some form of stress. This is your critical element. If it's stimulating the release of GABA, GABA is a major inhibitory neurotransmitter on the central nervous system. GABA is a critical element. That balance between GABA and glutamate is going to be essential for good quality relaxation, ultimately leading to sleep. So 5-HTP, this is a definite, between this and taurine, I'm going to tell you these are essential starting points for sleep. So 5-HTP helps support relaxation, calmness, and mood, stimulates a deeper sleep, supports neural tissue, increases serotonin levels, no associated drowsiness. So let's go over one more time, or let's go into a little detail, how does 5-HTP work. For 5-HTP belongs to a class of chemicals known as nootropics. There's 2 to 3 different ways to say nootropics. We'll go with that. These are chemicals that alter brain chemistry to produce a desirable psychological and or physiological effect. Good example of that is improved mood and a sense of well-being. Chemically speaking, 5-HTP crosses the blood-brain barrier and is converted into serotonin, a neurotransmitter which promotes calmness and relaxation. By enhancing the levels of serotonin in the brain, 5-HTP can help support mood, relaxation, neural tissue, and sleep quality. There's further data that suggests that 5-HTP supplementation actually supports weight loss by reducing food intake. It is suggested that an increased level of serotonin may help individuals eat less food overall, and that ultimately impacts body weight. So 5-HTP may be something that you want to consider as almost a foundational supplement. Pure taurine, we talked about it before in the idea of the excitotoxicity. Pure taurine is also great. It has a gut benefit in that it increases the release of bile. Bile is a critical element to overall gut health. Here we see taurine. It's a great, I just was able to get this slide. Taurine actually blocks excitotoxicity, neuroinflammation, specific stresses. It also promotes QC, the quality of protein, energy metabolism, gene expression. It's also known to work interesting in taurine derivatives and novel drug delivery to the overcoming taurine limitation and the amelioration ultimately of neurological disorders. And we saw this one before. So this is just to reiterate what taurine can do. So essentially taurine once again blocks the opening of the synaptic cleft that allows glutamine to allow for neural excitation. The mattress. Many chiropractors are listening, and the mattress is an interesting thing. The first thing I'll say is most mattresses have flame retardants. So just as a takeaway, always look for a mattress without a flame retardant because we spend 1/3 of our life in bed. So the mattress should provide comfortable surface without question. It's something that patients ask me all the time, what mattress, what pillow do you recommend? And going into chiropractic and functional medicine, I didn't realize that we would talk about it, but it is so valuable. You want a mattress to provide natural body curves, no pressure points, lead to better sleep. There's specific nutrients that are great to sleep, but there's also specific materials like open cell memory foam has shown to contour to the individual's body. They will lead you down a path of not adding to tender and trigger points. They will actually distribute body weight evenly. Try and find a mattress with no flame retardants, made without mercury, lead, and other heavy metals. And here's some of the other things that I would recommend taking a look at in this slide. Before we go any further, sleeping position matters. So sleeping on your back, interesting. Most experts agree that sleeping on your back is ideal position, but it's not for everyone and it isn't good for your back. When you sleep on your back, you stretch your body out evenly on the mattress. Your head, neck, and spine are aligned in neutral position. There is an extra stress to your lumbar spine. I recommend as a chiropractor, you sleep on your side. Your pillow matters. You want a pillow that support your head in a neutral position and not put stress on your neck. One pillow, please. So I have to make a correction. Sleeping on your back is fine. I apologize. It doesn't damage your back. I confused myself. Let me make the correction now. Sleeping on your back is an excellent choice for your back. It's sleeping on your stomach that poses the issue because it'll lock down on your lumbar spine and it locks down on your joints. And also make sure you choose the right pillow. Once again, that single pillow is a great choice. So the takeaway here is sleep on your back is good. You may want to bend your knees and put a pillow under to correct what I said earlier. Sleeping on your side is great. Your left side is best. One pillow. Choose a mattress without flame retardants. Sleeping face down locks down on your joints, damages your facets. Not a good choice to get good quality sleep and heal your body. Sleep encourages concussion recovery. Athletes who get good quality sleep after sustaining a concussion are more likely to recover in 2 weeks. Those who take longer can take longer to recover, up to 30 days. Girls are more likely than boys to have poor sleep quality. Yes, we now know that it was antiquated to tell people not to go to sleep after a concussion. We didn't go to sleep, or they recommended people not to go to sleep because they thought they wouldn't wake up, obviously. As long as there's no bleed, rest is a great choice. That's where your brain recovers. So we're going to cover concussion in more detail in some upcoming webinars. Just to the side, the new literature is without question breathtaking to the idea of how to treat a concussion and the lifestyle changes. For instance, the sleep, the position of your head, what they eat, getting them back to exercise without moving their head. These are things that are going to lead to the kind of outcomes that we all want with our patients and our athletes in our office. Sleep impairs the blood-brain barrier. Take a good look. Look at the left side. The blood-brain barrier after a full night of sleep shows that the tight junctions are intact. Nothing passes. Your blood-brain barrier is your barrier to your brain, clearly. It filters 400 miles of arteries. Once passing an antigen, bacteria, virus, or pathogen passing the blood-brain barrier, there's damage to the blood. And as you see here, the blood-brain barrier after sleep loss, you're going to see an increase in TNF alpha and interleukin 6. So to keep our blood-brain barrier healthy, just like our gut barrier, sleep is a critical element. The lack of sleep, as we talked about earlier, increases the amount of Alzheimer's proteins. Sleep-deprived brain has, as we alluded to earlier, excessive amounts of tau proteins and increased amounts of amyloid beta globs. Sleep can decrease the risk for Alzheimer's. Sleep is a part of your lifestyle, which is a main component of what we talk about in our functional medicine, functional nutrition model. Sleep and detoxing the brain. Sleep allowed for the clearance of the central nervous system metabolites, as I said earlier. including amyloid beta. Amyloid beta cleared 2 times faster in sleeping mice compared with mice awake. It's that squeezing, flushing effect, that sponge-like effect that you have when you sleep. You, again, shrink to 40% of your brain size, squeezing out your toxic wastes. The brain undergoes high level of activity while sleeping. It is without question a chance for its time to purge harmful metabolites. So we're getting close. We have a couple of minutes left. I wanted to answer any questions or have a brief discussion without any questions with Rob. To sleep, perchance to dream. To sleep, perchance to heal. Nutridyne will be supporting my book. It is scheduled for January 2021. It's called The Superhighway to Health. There is without question a sleep component in there. It's the 7 steps to optimizing the gut-brain connection. Clearly, the gut and the brain will heal from sleep. It's covered in my upcoming book. So now I have about 3 to 4 minutes. I'd love to open it for some questions or a little back and forth with Rob. You guys have been great. I hope I was able to illuminate you on certain factors. Any questions? I'm here to answer.
Thanks very much, Dr. Rob. Yeah, we've got some questions from people, which I'll fire away now. We'll get straight into. Just before I do, some people will note that there's quite a big missing section on melatonin. Unfortunately, in the UK, we're unable to sell melatonin as a supplement. It's illegal and it's only for prescription from a doctor. There are some countries in the EU which you can sell it in smaller doses. If you are from one of those countries, feel free to reach out to Dr. Rob. I'm sure he's got a ton of information on melatonin, how it can improve sleep. So right, question 1. Which test would you run to get more information on factors which could affect sleep?
You know, I think the cortisol is a great choice. And that's a standard test. But, you know, if inflammation is up, cortisol's up, vitamin D is down, you're looking at someone who's inflamed, they're probably not getting good quality sleep. So there's not a specific test. There's a litany of markers. And I can tell you this, and I'm amiss about this, I had not included sleep in a discussion point. And since I have, my outcomes have increased, and my outcomes with the gut and the brain, which is the emphasis of what I try and do in my practice. 50% of my practice is gut to brain, and everything becomes a great periphery to that. Sleep was an important marker. And I can tell you this, right now, we know that there's stress because we've all gone through in a health pandemic, whatever you want to call it. People are stressed and they're not able to sleep, or they were sleeping too much and not getting good quality.
Cool. How can the gut affect sleep? I presume that's got something to do with the microbiome and serotonin production in the gut.
Correct. 93% of serotonin comes from your gut. If your gut is not in a healthy status, you're not going to produce the needed neurotransmitters to get sleep. The body's all interconnected, and a great starting point is the gut. It doesn't mean you have to be myopic to the gut. You just have to understand that it's a great part. You know, it's funny. I had a martial artist come in who's interesting, and he does a martial art where they protect the midline. And I said, that's great. He goes, everything vital's in the midline. You don't die from the periphery. And he was protecting his gut, his chin, and his brain. It's interesting.
Are there any specific gut-related issues which you've seen which can cause poor sleep more than others?
Yeah, dysbiosis, leaky gut, the typical list of damage to the gut lining. And those are standard tests that I take here. That I think they're available to you. You know, I take them in conjunction with our standard or advanced, if you will, CBC.
Yep. Can the overuse of a certain herb reduce their effectiveness over time? Would it be a good idea to cycle different herbs?
Yeah, the herbs that we mentioned, I don't know. There's no literature that said that they need to be titrated or cycled. Herbs like berberine do. Herbs like melatonin probably you would, I understand you guys have a bit of an issue with that at this point, but So the ones that we recommended, no. Again, I don't know that I always give someone a supplement formula for perpetuity. It may be get over a certain time. If they're having trouble with sleep, yeah, give them the sleep formula. But the question is, get to what we call root cause resolution and find out what the real problem is, why they're not getting to sleep. Don't do the Band-Aid on a bullet wound. Help them, but then get to it. And that's when practice becomes fun. You feel the value. And you really don't have to advertise that much because people talk about you.
I suppose what we could do in the UK, in certain parts of Europe, is offer 5-HTP with cofactors, make sure the cofactors are high, which will ultimately help serotonin and ultimately melatonin production.
Yes, I agree.
Cool. Finally, do you have any recommendations for jet lag? I know melatonin would be a go-to for that one, but anything else that you know of?
You know, it's a great question. And here's the funny part. So, and everybody knows I live in the US. I know I hide my accent well. And that's American sarcasm. No, if we go from east to west, it's not as bad as going from west to east, interestingly enough. The studies had shown that. So jet lag, again, is, and it's very difficult because if I come to you guys, you're 5 hours ahead of me, and I try and keep my schedule, my rhythm to the same on the East Coast as everything, it becomes hard. So the jet lag to avoid is definitely increase your electrolytes and take some of these supplements and keep your gut in its most pristine possible condition.
Perfect. Thank you so much. That's it for the questions. I'll make the webinar recording available tomorrow with the notes for anyone that wants to rewatch it and make notes, further notes. And next webinar with Dr. Rob will be on the 20th of August, and it will be on integrating fasting into nutrition protocols, which will be a great talk. So thank you very much to Dr. Rob. Thank you for everyone for attending, and we'll hope to see you soon.
Thanks for everything. Looking forward to seeing you, and I will send out that PDF right now.